Hello, and welcome to another brand new episode of the Empower MEN1 podcast. Today, I have with me Tracy, who has very kindly agreed to come on and share about her story and her experience with MEN1 so far and everything that her health journey has taken her on up until now. So, Tracy, it's so cool to have you on. Thank you so much for agreeing to be here and share your time and your wisdom. I will jump in straight away with the first
Okay.
question, which is pretty simple. But in as much or as little detail as you want, what kind of is your journey and your experience so far with MEN1, kind of with this diagnosis, but also with health in general?
Well, I'm really excited to be here too. So thank you. Um, so my story is definitely detailed. So I'm 36 and I didn't know that I had an MEN1 until I was 33. So growing up, I had just a ton of issues. I was in and out of the hospital like constantly as a kid with uh, really misdiagnosis. Doctors really didn't know what was wrong because I was having like a lot of GI symptoms. And so I was seeing specialists and they were saying it could be IBS, it could be, you could have an ulcer. They really didn't know. And at the same time, I was also having like severe asthma. So at the age of 10, they diagnosed me with asthma, but it was to the point where I was hospitalized countless times. I was having to use like a nebulizer machine just to like breathe during the winter. It was really bad, like coughing up blood bad. And they blamed it on asthma. And so when I was 17, I was actually in college in Pennsylvania, and I had like severe abdominal pain. And when I went to the emergency room there, they did a CT and a spot showed up on my chest in my lung. And they actually blamed it on chronic bronchitis because I had it since I was a baby. Got it every year. And so we didn't think anything of it and I ignored it. So um, years went by. I got married and my uh, my body was still going through like a ton of issues. And with MEN, it's it's so involved in every part of your body. So I was having irregular periods for years, and we were trying to figure out everything you can think of. And my sister was like, "You need to like see an OB. This is not normal." So I finally listened to her, and my OB was like, "I think you might have a brain tumor." And I was like, weird for like your OB to say, first of all. Um, and of course, that's like a scary thing to hear, but she's like, so I want you to see an endocrinologist. So I went and saw one. They did a scan, and I have a pituitary tumor, super tiny, barely showed up. And because of that, it is causing a ton of hormone issues. Um, so after seeing the endocrinologist, I ended up just following along with her for a bit. Would get routine blood work, and so that was 2017. And so in 2019, I switched endos, and she was watching my calcium, and it kept on rising. Um, and it turns out that I had a parathyroid issue, which is one of the three P's in MEN. And so it's pituitary, parathyroid, pancreas are like the main type of cancers, tumors that you can get. So uh, in 2020, I had my first surgery, still not diagnosed. And that was April 2020, which was like height of the pandemic. Like I was in surgery by myself at the hospital. And then I actually switched endos because this one retired. And she was like, have you ever had genetic testing done? Because like you have two, like pituitary tumor, parathyroids. And I was like, no, but I'm totally willing. So she did, and it came back positive for MEN. So that was a relief and also awful all at once, because that happened. That was December 2020 is when I got my diagnosis, and it was like, finally they know what's wrong with me. And that was fantastic, but um, it has been a constant challenge since. And I've had that following June, I ended up having neuroendocrine lung cancer and had to have a wedge resection. I had a lipoma in my chest that I had to have surgery on. And then this year, I actually had to get an endometrial ablation, because I was just in tons of pain during my period. So that was the easiest thing to take care of it. And then I ended up having pancreatic neuroendocrine cancer in March. And I just said this year, it's 2024. Forget already. So that was in March. And they did a distal pancreatomy. So they took out a third of my pancreas and my spleen and my gallbladder all at once. And then my calcium started to rise again. And so in October, I had a parathyroidectomy again, and they actually took out my entire thyroid because there was a ton of tumors in it. And it actually came back with tall cell papillary thyroid cancer, which is not a MEN1 thing, but people with MEN1 can get it. So 2023, I'm glad it's gone. Yeah, so here we are. And I still have, I have tumors in my lungs, and I have a spot on my liver, and we're watching things. And not having a spleen has been quite the challenge, along with less of a pancreas is quite the challenge with eating and normal function. Yeah, my body's definitely been through a lot in such a short amount of time. So yeah, so here we are.
Here we are indeed. And yours is definitely, I would call it a colorful story. I think there's a
For
lot
sure.
that goes on there, and it's fascinating. A lot in a very short space of time. Um, I mean, a couple of the things, well, actually, everything you mentioned was fascinating, and I kind of want to pick up on all of it. Right back at the beginning, you mentioned about, before you knew about MEN1, before you knew about the diagnosis, that you had these symptoms and no one was really sure what to attribute it to. And, you were being told, oh, it, could be IBS or, these sorts of common things. From what I understand, that is very common within the MEN1 sphere, where actually it's just not very well known and it's pretty rare, and a lot of practitioners don't know about it. What was that experience like going through that, where actually you were kind of, being a bit misdiagnosed at points, or maybe kind of pushed in the wrong direction? How did you manage to kind of find your way to the right place?
I think that as a kid, it was exhausting, and very difficult, especially as like a kid being in and out of the hospital so much, and they're my friends weren't. And so it was a big challenge to constantly be at doctor's appointments and them like questioning. And so uh, it was kind of just like I was going with the flow. I would just end up trying to find a doctor and trying to figure out what it was, and going through a ton of tests. And then I moved from Massachusetts, in the United States, to Connecticut, which is like right over the border, when I got married. And so my insurance changed completely, and I joined like a completely new system. And so that I got married when I was 22. And so that kind of started me on like this journey of having actually, like, I felt a better healthcare system for me. And that's where I found like my OB and everything, and she like started that path. So I think that I think that it was more of just like I don't want to give up. So let me just see what we can do. And I just endured like countless tests and hospital visits until we found the right person.
There's a lot of
Yeah.
that, isn't there? It's, absolutely being persistent, I think, is the way I would look at it,
Yeah.
which is hard. But yeah, you did it. And I wondered, you mentioned that when you actually received your diagnosis, that it was this funny mixture of being relief, but also like really awful as well. And I wondered, like, can you explain that for us?
So like I went to this genetic counselor, and he he was like, there's no way you have this. He's like, I'm looking at all of your family history. There's nobody like that has any type of things that are related. You don't have this. And he's like, it'll take like 2 weeks for you to get the results back. But so I'm thinking to myself, well, at least we're trying something. And then he calls me, and it was December 14th. And I pick up the phone, and he's like, Tracy, you have it. And I laughed at him on the phone. And I said, of course I do. Like, because I was just so shocked, because it's a cancer syndrome, it's not, and it's just so rare. And for me to be going through this for 30, my first like issues was that when I was like 10, so it's over 20 years of just constant like tests, that I was like, if it's not this and it's a super rare thing, like what could it be? So to know that it was like, okay, so now we can make a plan. We can watch specific things that are like the more popular type of cancers and get the blood work that's necessary. So like, we get blood work every couple months and scans like a few times a year. And because of all the different things, I'm just getting scans all the time. But now we're able to watch it, where, before it was like guessing games. So it's a relief in the sense that it's okay, we can see this is a specific thing that, your calcium, let's focus on that, like having specific things to focus on. But at the same time, like, it sucks. you know there's really no other words.
Absolutely. I completely get you. Um, I wanted, you mentioned about you've, as a result of all this monitoring and this scanning, you are aware and your medical team is aware that, there is stuff inside your body. You said, there's tumors here, there, and in other places as well. If you said that to any other human being, they'd probably be like, what? Like, oh my goodness me, you have all this stuff and you're still functioning, you're still smiling, you're still walking around, you're still living. Like, what is it that helps you stay positive? Like, what is it that helps you keep going at life, like regardless of what's happening inside your body with your health?
Hmm. It's interesting. That's a really good question, because it's there's definitely days where I'm like, I really wish I didn't know what was happening inside of me. um, but I think that so I have dealt with like severe depression, and anxiety and PTSD. And during the times where I've been super depressed, it's sometimes easier to give up. And it's not that you want to give up, but it's just like, I don't want to live like this anymore. That's what a depressed person like really feels. They just don't want to be in that state of mind anymore. And so when I'm constantly given all these different types of diagnosis, it's either I can give up and let my body take over from the inside out, or I can try to keep going. And so I am 36, and I no longer ask like, how much time do I have left? Because we have like this weird um outlook of what's inside our body and what's happening. So like we have a different timeline that is more realistic. And I don't want to know. I want to be able to just live my life in a way that I can be an example for other people to just like push through. I feel like I don't have a choice. It's either I give up or I'm trying. And don't get me wrong, there's days where I'm like done. And my body's like, you're not gonna function today. And that's okay. And I think that's real, and that I'm doing the best that I possibly can. And I know that, like, for me, like, I believe in God, and that I want to just pursue and be a good example for other people, and just encourage those out there that they're not alone. And so that for me is like my reason to keep going, is really just to be an example for other people.
It's amazing. It's really inspiring. It really, really is. I also, when I got to know you, found out that you have a kind of very artistic slash creative side of you. And I wondered if you could tell us a little bit about that, because I don't know if there might be some listeners here who are following your page, or they might have seen some of your stuff. What is it that that does for you, and what is it that it gives to other people?
Sure. So yeah, a few years ago, I used to be a children's director at a church, and one of my friends asked me if she knew that I painted. And so she asked me if I would actually paint murals in the children's department. So I actually painted like 7 different rooms and like the area where they all met. And that was the first time that I had painted since like I was 17. So I went from like, it had been about 10 years since I had done any type of art. And I was like, what have I been doing? I've missed this so much. It's so therapeutic for me. I just feel like when I immerse myself in art, that everything just shuts off. Like, I don't have the negative thoughts, and I'm just focused on what's in front of me. And so I had started over these last few years doing a lot of drawing. I do a lot of digital art, pencil drawing, and then I do a lot of painting with like a 3D acrylic paint. And so I do a lot of craft fairs, and I just during the winter mainly, and I get to meet a lot of people. And one of my favorite things that I did the first time that I did any type of drawing, I did these stippled lungs, and it was right after I had lung cancer. And that has been like one of my most popular things. So it strikes up conversation, and I can like advocate for MEN a little bit, and people like, are very really like, I've had cancer, they end up having really great conversations around it. So it like opens up really good dialogue, and it's super encouraging. I love it. Yeah.
It's amazing. It's really amazing to see. And I love it when I speak to guests who have managed to find a way to create something beautiful out of a really big challenge in their life. I think
Yeah.
that's what, what it shows me. And yeah, it's really, really beautiful, beautiful artwork. I've seen it myself. Um, so Tracy, I could probably spend all day talking to you, honestly, if I didn't have a clock facing me right now. So I have one final question to ask you, which is, if you could go back to your younger self, or maybe a point at which it was really difficult for you in your health journey, and give yourself one piece of advice, what would it be?
This is a tough one. um, you know, I I always felt like a little bit crazy growing up, because there was no diagnosis, and I was just having so many issues. Um, and so I think that I was thinking about this the other day, because so in high school, my friend and I, we used to have this notebook that we'd write each other notes in, and we would trade it in between classes. And I saw her for the first time recently, and she's like, Tracy, you have to read the notebook. She still had it, which was amazing. So I read this notebook, and I'm just page after page is me saying like, I feel so sick. Sorry, I wasn't in school yesterday. Like I was in the hospital. Like throughout this like year-long book is just me like constantly saying like how sick I was. And as I'm reading it, I was like, here's my validation. Like I I'm not crazy. Like, so I would definitely like, as I was thinking, I'm like, I would tell this like younger version, like to keep pursuing and advocating, because if we don't advocate for ourselves, no one else is going to. And I feel like after years and years of going through all these doctors and visits, that if I hadn't just kept pushing, like I still wouldn't know what was going on inside of me. I still wouldn't have a diagnosis that can be helped. And so I think that would be it. Like, you're not crazy. Keep going, like keep pursuing. And yeah, I think I'm really glad to have a diagnosis as much as I hate it, because now I know like that I did what I needed to do. So
That's
yeah.
incredible. It's truly inspiring. And I really hope that anyone listening back, can find, gold and value in what you say, because it truly is, as I said at the beginning, a very colorful story, but one that has a lot of beauty to it as well, just in terms of your approach and your honesty and authenticity as well. So thank you very much for coming on, for sharing your time, for your wisdom, your nuggets of gold. And I wish you all the best with your health, with everything going forwards. And very much look forward to keeping in touch.
Definitely.
Thank you, Tracy.
Thanks.